As the Director of Opioid Response. I want to welcome all of you to our monthly seminar series, where this morning we're very fortunate to have three terrific people presenting on the topic of prevention. I've often said in our focused area in our strategic opioid response plan that we wish we could commit all our resources to prevention. It really is the most important thing and the only way that we're going to get out of the difficult situation over time that we're in. But we have to face also what's right in front of us, whether it's people overdosing, people needing treatment, people needing recovery support, and delivering more harm reduction. But we don't want to forget about prevention. We want to commit as much as we can to it. We have many offices and departments in the state that have a piece of the prevention. But this morning, thought we'd present really where the bulk of the work is done in three places: the Department of Education, the Maine CDC, and the Office of Child and Family Services. Again, I don't mean to leave any other place out. Corrections is involved, even public safety, but this is a good place to start, and it's really wonderful that we have been able to put the three people on the panel that I'll introduce in one moment. Just some housekeeping matters: that those of you who need CME or registered for CME or continuing education credits of any kind, when the evaluation, there'll be a link sent out to all the participants, and once you complete the evaluation form, send that back into AdCare. AdCare will send you your certificate. Those who need CME pay $25 for us to take care of that. For all the rest of you who are just here to learn, then it's a free webinar. We intend to continue to do these the first Friday of every month, but the first Friday of January is New Year's Day. So we will do a seminar that month on the 8th, on the next Friday, again from 11:30 to 12:30. We're still we've not picked the topic. One of the first two seminars next year will definitely be on our amendments to our opioid response strategic action plan that a large group of people, including the governor, are working on. So hope we'll see you again in January. We've had wonderful response. We've got already about 189 of you participating at this moment, and we're thrilled with that participation. If you have questions, this is not interactive. You can't ask those questions in this format. We ask that you put your questions in the Q&A spot on the Zoom. Rather than in the chat. You can chat amongst yourselves in the chat room, but put your questions under the Q&A slot, and I, as the moderator, will review those, and we've saved at least 10 minutes at the end to handle questions. We probably won't get through them all if there's a couple hundred people involved, but we promise to get back to answer every question following the seminar and put those up on the one of the respective websites. I want to thank Brooke, our closed captioner, who is with us this morning, and that's such an important service to make available. Without further ado, I'm going to introduce all at once our three panelists in the order that they're going to present. They all have a few slides, and I'll try to keep this going and keep us on time. So our first speaker is a person I've learned a lot about prevention from, Christine Theriault. Christine is with the Families First Prevention Services Program Manager now at the Office of Child and Family Services. But many of you got to know Christine, as I did, when she was previously the Program Director for Tobacco and Substance Use Control in the Division of Disease Prevention at the CDC, at the Maine CDC. That's a good way to segue into Leanne Lavoie, our second speaker, because Leanna is in Christine's previous position as the Program Director of Tobacco and Substance Use Control at the Division of Disease Prevention. And then batting cleanup today is Bear Shea. Bear is the first social emotional learning specialist in the Department of Education. And his formal title is mental health school counselor specialist. And so we have representatives again from the Department of Education, from the Maine CDC, and the Office of Child and Family Services. And we're going to begin with Christine. And I want to thank all our panelists in advance.
Thank you, Gordon. Just started. So welcome everyone again, and thank you for taking the time out of your busy schedule to learn more about prevention, which I think many of us here today are all very passionate about. So as Gordon said, I'm Christine Theriault. I'm the program manager for the Family First Prevention Services Act with the Office of Child and Family Services. So I thought I would start off by just setting the groundwork for what is prevention, to make sure that we're kind of all, starting from the same spot. And so as we probably all know, prevention is really defined as the action of stopping something from happening or arising. And so it really focuses on looking at protective factors and increasing protective factors and decreasing risk factors. And so this is across the board, whether we're talking about a medical condition such as heart disease or diabetes, or we're talking about something including substance use or mental illness or even child abuse and neglect. Prevention really focuses on how do we really increase what supports that families or children or individuals could have, and how do we decrease the risk that's there for those individuals. So we know that, whether we're talking about the prevention of substance use or mental illness or domestic violence or suicide or child abuse and neglect, there's a lot of risk and protective factors that are overlapping. So the strategies that we are implementing to prevent those types of behaviors and things and diseases, there really is a lot of work that happens across the continuum, which we're going to talk a little bit about today, that continuum of prevention. So for prevention, there is multiple strategies that are needed across multiple settings to impact change. It's not just one particular intervention that happens that can sometimes prevent something from happening. It's multiple strategies. And again, we'll talk about that more in just a moment. So there are actually three types of prevention. So I'll start by talking about primary prevention, which these are services that are often provided to individuals before a problem or symptom exists. And so oftentimes people who are receiving a primary prevention intervention don't even know that they're receiving it. This we'll talk more about some of the different examples of what primary prevention is, but it could be messaging that we're receiving on a regular basis about our health or about exercise or about well-being that is a mechanism and a way to prevent much of the things that I've already kind of listed at the beginning. Secondary prevention comes into play when we're providing interventions when there's some risk or problem behaviors have started surface. So this is more of intervening with populations who may have some risk present. Tertiary prevention really focuses on providing services and interventions after a problem has already been identified, and we're trying to prevent the problem from getting worse, and we're trying to alleviate the symptoms that might be in existence as it relates to that problem. So these are interventions that are typically provided to those individuals who are at high risk. So I just have a few examples of each of these different categories to help understand a little bit more about what we're talking about in this continuum. So primary prevention, as I mentioned, some of the strategies that exist across the state or even across the country include media campaigns, media messages that educate people about the risk and harm of either using substances or engaging in a behavior. Laws and policies are considered primary prevention. There could be things that are in place to prevent access and availability of substances or reducing the availability of a certain, the opportunities for certain behaviors, those kinds of things. Education on domestic violence, substance use, mental illness, parenting, education, those kinds of things education on coping skills. Those are all also primary prevention type interventions. Reducing access and availability of substances or risky situations is also an example of primary prevention. Oftentimes you probably have heard about primary prevention being considered as the further upstream. So the further upstream that you intervene with a child or with a family or with an individual, the more likely it is that you're reducing the occurrence of some sort of, again, behavior or disease or risky situation. Secondary prevention examples include screening. So screening, whether it's for any kind of disease or substance use disorder, screening and identifying early on that there's a problem and providing an intervention really falls under secondary prevention. Education programs and case management services also fall under secondary prevention. So tertiary prevention, again, intervening after the problem has already existed. This is where services like treatment, recovery, overdose prevention, parenting, education, those all fall into that. So having worked in the field for several years myself in prevention, I've come to learn that many times people who work in the treatment and recovery fields may not think of themselves as doing prevention, because oftentimes we think of prevention only being the further upstream primary prevention interventions. But the reality is that we're all working in prevention in some form, whether it's primary, secondary, or tertiary prevention. So this visual is sort of just to kind of take you down a path of prevention to show you that, you know, thinking about this in terms of one individual who may be going through life, we have this path where there's multiple different ways that this individual is receiving interventions of prevention. Again, whether it's primary, secondary, or tertiary prevention, whether it's that child's parents who are receiving parenting skills, or getting education on safe storage or safe sleep or coping skills, or treatment and recovery services. Also, that child goes to school and there's school policies that are in place to help to reduce, you know, maybe substance use within the school setting, or maybe there's policies in place related to bullying and other mental illness or mental health type situations, youth groups, positive activities, supportive adults, and social emotional learning. Then that child may attend a church or a religious organization, and they're providing education and support to families as well. And then healthcare is involved by the screening that is going on, you know, within seeing their primary doctor. There may be some sort of screening for substance use or other medical condition, mental health condition. The provider may be referring them on to services and educating them on the risks of use or certain behaviors. And then we have the community, which plays a huge part in prevention in providing education to families, support to families, housing, all of those social determinants of health and other positive parenting supports that could be available to families. So as I said earlier, we can see that prevention is everywhere, and we may not think about it as prevention, but it really is everywhere. And it takes all of these strategies to be able to support an individual and help them to be healthy, and whether it's substance or mentally healthy or child abuse and neglect free, all of those things. So now I'm going to talk a little bit about what the work is that's happening at the Office of Child and Family Services for prevention across this continuum. So for primary prevention, within the department and within OCFS, we are currently funding child abuse and prevention councils, which have been established as part of a legislature. There's a statute in place that specifically established these councils. There are councils across the state that are county level that work really to support families, provide education across multiple different systems. They make referrals to services. They use community assessments to determine what are some of the child abuse and neglect risk factors within that community, and they choose strategies to implement based on what those risk factors are. They focus on the period of purple crying. They focus on safe sleep. they really focus a lot on those protective factors and how do we support families and engage in families and educate them on the protective factors, as I mentioned earlier. We have the Child Care Subsidy Program, which helps fund parents to get childcare when they need to go to work or when they need to get into services for themselves. At the same time, it helps support the child to get them ready for school. We have an early childhood mental health consultation program as well, which has also been established through the legislature, which really focuses on how do we increase the availability and access to services for those children who may have special, emotional disturbance needs and those kinds of things. And so it's focusing on working with the school to provide the school with support on supporting those children, as well as providing support to parents so that the child is getting supported both by the school and through skills of the parents. So we also have improving youth outcome grants that are funds that are going to community providers to provide some special programming for whether it's after school programming or other programming to help support youth to, again, really increase those protective factors and decrease those risk factors. So secondary prevention interventions that we have, targeted case management, we have our alternative response program, which intervenes when a family has been reported to the department and more services may need to be offered after the department has done an investigation. And also our youth leadership advisory team, which focuses on empowering youth who may have been in the foster care system to again, increase those protective factors and help them to grow some leadership skills as well. Parenting coaching is something that actually, focuses on all three of prevention types. It falls into that. So we're doing some work with that. Systems of care grant, again, focusing on children's behavioral health, falling more into the lines of the treatment and tertiary prevention. Supportive visitation, crisis services, domestic violence, sexual assault services all fall into tertiary prevention. So this is also where the program that I'm currently managing, the Family First Prevention Services, falls into. So it's kind of interesting because over the past 10 plus years, I've worked in the field of primary and secondary prevention, and those were my primary areas of focus. And then moving into this position this year, working and focusing on tertiary prevention, it really opened my eyes up into learning more about how the different areas across the state that we all do really play a role in all of the prevention types. So I really want to talk quickly about the Family First Prevention Services Act. This is a federal law that was passed in 2018, which focuses on federal support to states to prevent children from entering into foster care by providing families with trauma-informed, evidence-based substance use, mental health, and in-home parent skill-based programming. So that's the work that we're currently planning for and working on to try to really prevent children from entering into foster care by keeping children in the home when it's safe to do so and providing them with these services to be able to really help support families. So the other part of this is improving the quality of appropriate and appropriateness of residential care for those children who do need to come into care, but I'll focus more so on the prevention services piece of this. So I do have this prevention pathways document that we've kind of created to show the different pathways that families and parents across the state of Maine could access services. And again, I've talked about the different types of services that are available. And this section down below, the blue section, is our definition of candidates for Family First Services. So again, it's those children who may be at risk of maltreatment and may be at imminent risk of being removed from the home, but we're able to provide them with those services to keep them in the home. So I want to talk about this great partnership that's happening across the state through the work of multiple state offices that is really trying to identify and show that there's multiple services that our offices are funding or implementing. So the state agency partnership includes all of these different state offices, and we're really working on right now creating an inventory of services that are already being funded or provided, again, across primary, secondary, secondary and tertiary prevention. We're looking at identifying the gaps in services and sort of creating a guide so that people know about what services are out there. Because one of the biggest things I've learned in the prevention work that I'm doing currently is that the access, availability, and knowledge of services is one of the biggest gaps as we look at tertiary, primary, and secondary prevention across the state. So lastly, I just want to say that really we all have a role in prevention. You might have heard this before, but I really feel like whether you work in prevention, whether you work in treatment, whether you're a parent, whether you're a school personnel, no matter who you are and what your profession is, we all have a role. And hopefully the visual that I've shown you earlier really shows that we all need to work together, whether, no matter what field you're in. And so thank you all for, again, being here and dedicating some time to learn more about prevention. And here's my contact information and our website information if you would like to contact me in the future with any more information about the work that we're doing.
All right, thank you, Christine. What a great presentation, and really set the stage for my presentation here at the Maine CDC. I'm just going to share my screen. Oops. Okay. Can you see my screen? I don't know. I'm assuming you can. Okay. So my name's Leanna Lavoie, and I am, as Gordon said, the Program Director for Tobacco and Substance Use Prevention at Maine CDC. And today, in my short time, I'm going to briefly just kind of share with you our primary prevention funding structure for Maine CDC and the state, and then also highlight some specific opioid prevention strategies and outcomes. I think this is important to have a visual of how we get funding out to the local level. And a few key points here. So Maine CDC receives funding from multiple different sources. And in this is in the structure, it's called the Maine Prevention Services structure. We contract with the University of New England, who then works with local coalitions and organizations to implement primary prevention and secondary prevention initiatives in their communities. Additionally, we provide funding for rink advertising for our media campaigns, as well as we work with AdCare to provide educational opportunities throughout the state. And then lastly, we contract with 2 evaluation partners to help evaluate the work that we're doing. And I just want to note that this is one arm of our prevention work. There are 5 different ones. So this is one example of our substance use prevention work getting out to the local levels. We work with 20 agencies and organizations and coalitions throughout the state of Maine, and this is simply just to show you the representation across the state and the organizations that are receiving funding to do this work. In addition, that I just want to say, with the substance use prevention work, we use SAMHSA's strategic prevention framework, which is around assessing, capacity, planning, implementation, and evaluation. So that's the framework that UNE uses with the local coalitions in partnership with Maine CDC. So Christine, thank you again. You did such a great job explaining the different prevention, the continued care for prevention. I'm not going to spend a lot of time on this slide, but I really wanted to show, on this kind of continuum prevention, the different ways we work in prevention. And this is not just the work of my team with tobacco and substance use prevention, but it's also other organizations within the Maine CDC. And then underlining all of this is the the Mass Reach Health Communication, and then our state epidemiological outcomes work group, and the data that we collect that helps support all of the work that we're doing. So I thought it was important to kind of talk a little bit about that. And I can't get into the details, but I'm more than happy to share after the fact. The next few slides, I'm going to focus on the work that we're doing in primary prevention and the work of the UNE and the coalitions and organizations at the local level. And again, I'm just going to highlight a few things, and then at the end, I'm going to share a couple success stories. So the first thing is, one of our major goals is to prevent and reduce youth and adult misuse of prescription drugs. We do that by providing trainings on safe storage. And I did see a question in the chat about what is safe storage. And so that is really around providing education to people who have prescription drugs to store them safely, to prevent child access, to prevent theft, to really keep their medications safe away from people or children or animals that should not have access to those medications. We promote and support drug take-back days, and then clinical education and workforce development. So those are kind of the three major interventions that we work on at the local level. And there's some visuals here. So just a couple of success stories this past year. The outreach efforts for the organizations, and I'm really proud of this, have resulted in over 2 million individuals who participated in presentations, events around all of these efforts. And that, we have, our population is 1.3 million in Maine. So, probably a lot of people probably attended multiple times, but we had a really big reach this past year around these issues here. For the safe storage, we collaborate with retirement homes, parent groups, healthcare. We hosted about 80 programs and distributed over 11,000 materials throughout the communities. For the drug take-back day, between the bins and the take-back days, over 19,000 pounds of unneeded medications were collected this past year. And I'm happy to report, even with COVID, this was an increase from the 2019, which was 15,000 pounds. So despite, some of the challenges we faced this year, people were recycling their medications in a safe way. Oops, I skipped ahead. Provider education, clinical education. So we partner with AdCare, and our goal each year is to provide 30 trainings. And that is mostly in the way of webinars, which a lot of you probably have participated on. Some examples of this is the opioid updates, the clinical and legal updates. Let's see, opioid overdose prevention, harm reduction, resilient skills across the continuum of care. And this past year we had 26 webinars and over 1,400 participants in those provider education and workforce development. Another big goal that we are working on is to decrease youth and adult risk for substance use disorder. Sorry, I didn't spell that out. And so we're targeting desperate health populations, social emotional learning, which I'm not going to spend a lot of time on that because Bear is going to have a presentation that does a deeper dive into social emotional learning. Student intervention and reintegration program, which is SERP, and Prime for Life offerings. And I'm going to spend a little bit of time talking about that. The student intervention reintegration program, that's hard to say, so I'm just going to say SERP, is a 12-hour program. It's an evidence-based program, and we piloted that with well, okay, so let me back up. It's for 13 to 18-year-olds, and we're working with the juvenile community corrections officers who are the primary referrals for this. And it's for 13 to 18-year-olds who are at high risk or who have demonstrated risky behaviors with alcohol and drug use. It's a 12-hour evidence-based program. And in this pilot, we had about 130 participants complete the program. And there was 0 recidivism rate 3 and 6 months post-intervention. That is really exciting for us, and we're really hoping to expand those offerings. And Prime for Life, again, is a program for people who have made risky substance use choices, and it's a curriculum to really help prevent future use. One of the success stories that I did want to share here is AdCare collaborated with and actually Gordon was just sharing this with me. It collaborated with the Portland Recovery Community Center. This is kind of really working across systems around prevention and other statewide recovery centers to provide, it's called the Family Influence Program. And it really is about, talking and listening for parents and caregivers from the recovery community to strengthen their communication with their adolescents. And that has been a great success in collaboration with some of the work that's happening. For the Prime for Life program, this past year we had over 500 participants complete that program. And the other piece, there's a whole, a lot of work going around engaging youth groups, and I won't have time to talk about that today, but I just wanted to mention that. And we partner with the Maine Youth Action Network on that. Another big piece of what we do at the Maine CDC is our campaigns. And I wanted to just to briefly talk about our opioid misuse campaign, and it's called Eyes Open. This was a collaboration between Maine CDC and the Office of Behavioral Health. And really the intent and goal of this campaign was, that opioid use disorder can happen to anyone. And to keep your eyes open, know the warning signs, understand safe storage practices, understand where you can get rid of your, your medications that you're no longer using, and then how do we prevent youth from using. So if you haven't had a chance, I encourage you to check out our Eyes Open campaign on the website. And this started in 2018, and we are planning to relaunch some more campaigns this year as well. A couple messages that I wanted to share. When we ran this in 2018, the top performing messages was know the warning signs. And then in 2020, it was safe storage. We also have personal stories and information that you can order on our Maine Prevention store. So posters and cards. And then this just talks about the reach of our Eyes Open campaign. And I'm not going to spend a lot of time on this, but I just thought it was interesting to look at the age breakdown, and that the term drug drove more of the results than opioids, prescriptions, or heroin. Again, so as we're thinking about, how we're going to reach people and what terminology we should use, the term drug was most used. We had over 130,000 impressions, which means that ads popped up in front of viewers 130,000 times over the campaign efforts. And that resulted in 7,000 ad clicks. And then you could see the age breakdown, which is quite even across the age spectrum. However, when you look at our website, who visited, it was predominantly 55 and over that visited our website. And again, we're planning to relaunch our campaign in March through May. And I'll also mention we're partnering with the Office of Behavioral Health on their options campaign, which you're going to be hearing about over the next few months. So without further ado, I just wanted to share a couple success stories. And this first one is from the Knox County Community Coalition. They hosted an event that focused on substance misuse and senior safe medication through local trainings and presentations. They had incredible turnout, and the staff there said that many seniors, and many of you may know this, keep their medicines in a Ziploc bag that are in their room, in a place that is out and visible. So a big part of the work that they're trying to do is to educate, to make sure that they're storing their medications safely. And the staff there have said over the course of the year, they've noticed within the outreach efforts and trainings and materials they're distributing, that within that network, the seniors are doing a lot better job safely storing their medicine. So it just goes to show the community collaboration and how when they come together and talk and have these conversations can really make a big difference. So kudos to Waldo, to Knox County Community Health Coalition. And then the next story that I'll share, this is another great story that gets at local coalitions really meeting the needs based on their area. But this is with the city of Portland. They partnered with realtors to prevent prescription medication misuse through the promotion of safe storage and disposal for homeowners. So they developed a training and explored best practices for safeguarding and preventing prescription medication theft during open houses and showings. Who would have ever thought, right? So it was great collaboration with the realtors in the Portland area, and many trainings and resources were developed and distributed to help the realtor community address this issue. And so I had more slides, but I shortened it because I wanted to make sure I saved time for Bear. But these are some of the CDC resources that I encourage you to visit. And I think this presentation is going to go out to everybody. So those are some great resources to check out. And then if you need to contact me for any questions, here's my contact information.
So good afternoon, everyone. My name is Bear Shea. I am the Maine Department of Education Mental Health and School Counseling Specialist, and I am working quickly to share my screen. All right. Where is... There we are. So wanted to talk today about really just the incredible access that we have at the Department of Education for prevention. We know that, you know, we have these students in their communities, in our schools, you know, 30 hours a week, you know, 5 days a week for 185 days a year. And it really allows us to develop relationships, not only with students, but their families, and really connect to our communities as a hub. And, you know, just sort of an overview and a reminder, in Maine, we have 277 districts. And we're sort of unique in our state where we have districts where we have 7,000 students, and we have districts where we have 70 students. We have students that are still in one-room schoolhouse island schools, and schools where, you know, 100 languages are spoken. And so that sort of unique spread across the state between urban and rural, coastal and, you know, and mountain, it really makes for a really diverse and unique school district culture. Another significant issue that we run into with schools is our high poverty rate, and really working to provide support and resources, and looking at what are sort of the pieces that we can put in place to not only ameliorate that, but really look to connect with our community partners in the prevention work they're doing. And then what are the places that we as schools can be putting in our own prevention work? Because we're a local control state, where each district really has the say over what it thinks is best for its students. It can sometimes be difficult coming from the state level of looking at how can we develop programming that is accessible to every district, that that those differences and those unique things that are for each district and why they have their own programming for their own schools. How do we make something that's universal that we really can fit across all the states? And so when we're looking at prevention, those are the pieces that we're trying to figure out. In January, the Maine School Safety Center started. It's a new initiative in the Department of Education, and it's really looking at school safety not just as like a hardening of schools or prevention of violence or putting in place metal detectors. It's really looking at how do we take safety as a prevention approach. How are we creating positive cultures within our schools? How are we creating ease of access and shared information? And really looking at putting things in place so that we're reducing any of those negative impacts. So reducing violence, bullying, suicidal ideation. What are the things that we are putting in place? An initiative now that is just starting up in just a couple of schools here, but we're looking to go statewide, is looking at a system for behavioral threat assessment that really takes an approach that, again, is preventative and sort of holistic in building in support. So not just identifying what the risk level is when there is a threat, but also what are the supports that student needs and how are we getting them those supports. And this threat assessment model that we're looking to use is through Dewey Cornell, and it's really looking at how are we leveraging this through equity and making sure that there isn't a disproportionate effect on minority students or students from vulnerable populations. How are we making sure that schools have a consistent approach to threat so that we're not overreacting or underreacting, so that we're not moving students into a sort of a punitive pipeline, or that we're not ignoring students and increasing that risk. So that's a new piece of prevention that the Maine School Safety Center is putting out. They're also really working with school resource officers and developing trainings that will come specifically paired with the DOE that will have a trauma-informed perspective. That will be leveraged through equity and really focus on how are we developing those skills so that an SRO can interact with students in the best way, as well as accessing the community and school resources. And that also means working with the Department of Justice and what our juvenile justice system and how that works. Another piece that has been recently identified is really looking at developing this an anonymous tip line. We know that across the country, the three most common calls that come in are around suicidal ideation, bullying, and substance use. And so if that's something that we can get early access to, that it can be paired in with the trauma-informed practices and preventions that we're working on, and really work with schools to take that as a preventative step. Another piece that we're trying to work at the state level is having the department work with emergency management systems, trainings and certifications, and actually creating a professional development learning platform where micro-certifications would be available and trainings from experts within the DOE and DOE associates would be able to put up free trainings that would be there and available and easily accessible. Another approach that the Maine School Safety Center is really looking at is working on a statewide restorative practice system. So not just looking at restorative justice in our juvenile justice system, but also looking at restorative discipline in schools and restorative practices within the communities. So these are all pieces that have really started off and are quickly gaining, and we're really looking forward to moving those forward. As far as trauma-informed practices, my position at the DOE is as the mental health specialist, and it's the first time we've had a mental health focus in the Department of Education. And one of the asks we've gotten from the field is really looking for more ways of accessing trauma-informed practices, being able to assess where schools are at with their own trauma-informed practices, and then where are the pieces that they would be able to add those in. And so we've really been working on workshops that allow schools to select small teams that are leadership based, that are educator based, and that really take in sort of the stakeholders for the entire school and look at how are we assessing what are the pieces that are there and what are the pieces that are needed, and looking at the best practices that are most effective in school-based approaches, as well as just that overall development of what trauma-informed practices are and why they're so important. We know that we've had ACEs study for, 20 plus years now, and it's something we're still talking about and building that understanding. And so that's an effort at the DOE that we're really looking at building out. We have a number of asynchronous trainings on, basic brain science, developmental brains and how they work, really looking at safety and building in ways of working with students that are focused on developing skills and not punitive efforts. And that goes along with content area sessions that the DOE has been putting out. I think we've done over, I want to say over 10,000 hours of content sessions where educators, nurses, school leadership, school counselors, psychologists, social workers are getting, weekly meetings with their specialists, and so that they can get not only up-to-date information on where we're at, during this pandemic, but also really getting the best practices for engaging with students now and really looking at building in those preventative practices. And how do we really focus on that? Trauma-informed practices aren't just an idea, that they really are specific approaches. And instead of looking at individual initiatives that have been tried in the past, really looking at creating sort of a complete culture within our schools and within our districts of how we are working restorative discipline, and not just with staff to students, but also between staff. How are we holding that up as a preventative measure just to build safety within schools and develop those skills? And really looking at what are the best practices that are most effective. And underneath that umbrella really comes in social emotional learning. It's something that has been around for a really long time. Maine has a really strong history with SEL, and we've done a lot of work through CDC grants and other initiatives to really provide some of the best practice SEL programmings to districts. We haven't really had from the DOE a statewide approach on social emotional learning in schools. And so that's something we really took on. And we know that social emotional learning, I'm just going to talk about it a little bit for those of you that haven't had a lot of experience with it. But we really use the CASTLE model, which is the Collaborative for Academic Social Emotional Learning. It's our national best practice model. And so really looking at how are we building these skills, not just in elementary school, but really from a pre-K through 12th grade approach. Just like we understand that teaching students to learn to read is something that's so important that we do it across the entire spectrum and that we do it in every single class, whether it's math, history, or English. It's really an important piece. And so if we can get to where social emotional learning gets to that level, that the understanding that at the core of these pieces, self-awareness, self-management, social awareness, relationship skills, and responsible decision-making lead to a number of really important gains that we have seen over and over and over again in the research. Not only just better social emotional skills, better human beings, a reduction in violence and bullying, and a reduction in restraint and seclusion and behavior issues. And then really the positives, we're really looking at, higher graduation rates. We're looking at a much higher self-reporting from students about their own self-confidence, about their own ability to meet their goals, about their ability to get away from substance use and to use positive coping skills instead of negative ones. And so looking at that as a prevention piece, we knew that was important. We knew that looking at a way to get SEL across the state was a really good way that the DOE could put forward. So the our commissioner asked us to provide not just social emotional learning across the whole state, but make it free, easily accessible, have it be something that was complete culture. So not just something that was put on our teachers to run in classrooms, but really looking at developing it out into, how we're looking at leadership, how we are interacting with each other in the hallways, greeting students off buses, looking at our discipline, all of those pieces. And so through that process, we were able to work with Evolution Labs, who is a leader in social emotional learning. And the Department of Education has actually acquired a core curriculum of 450 classroom modules, pre-K through 12, that are owned by the DOE, that we are going to continually add to, edit, upgrade, and expand upon. And it really has become a foundational SEL programming. It also, because it's modular based and it's online, it's easily accessible in hybrid and remote situations, and it's super flexible. So it isn't just a prescribed order of modules, but that we can really work to build those modules with specific schools and districts to make sure that their needs are met. It also pairs in with all of the other strong SEL that school counselors and Second Step and other SEL programs that already exist in Maine. It really works in tandem with them because of that flexibility. And it can be translated into over 100 languages and has other ADA accessibility for it. So it's something that we're really excited about having as a state, and we've just rolled it out in the past couple of months. So we're really looking at at moving forward and having that. And I would love, I know I'm short on time, but I would love to just quickly show. Let me see here if I can. Here we go. So here's our social emotional learning webpage, maine.gov/DOE/SEL, SEL for me. Here's a PSA if you're interested in learning more about SEL and for our state. And know that it's a very low barrier and easy to access, simple login. Trainings are on here, free asynchronous trainings, and there will be ongoing support. So just wanted to share that with you all.
Well, Beth and Leanna and Christine, thank you. And you've all stayed, you did not go over your time. We have 8 minutes for some questions. And I really, I think speaking for all the participants, and there were well over 200, I want to thank you for your presentations. One question I want to throw out to all four of you is, I thought it was a great question. What is your number one prevention strategy? I'd like to have you all address it. It's hard to go first, but Christy, why don't you start, and then that will give Bear a second to think about it.
So I guess I would go back to what I indicated in my presentation as well, is that thinking about when we're trying to prevent substance use, mental illness, child abuse and neglect, like there's strategies that can actually be implemented that will cover all of those different areas. And the earlier on that we intervene with children to address, social emotional learning is a perfect example. It's not specific to a substance or a behavior. It provides children with the skills that they need to be able to just deal with and cope with life in general, or just gives them the skills they need to be able to live in this world, period. And it's things like that cover so many different areas. So if we give children and families the skills that they need earlier on, the further upstream, the better. And having multiple strategies that can cover suicide prevention, mental illness, all those other pieces. And that's really not a very good answer, because it's not one thing. It is one thing that can cover multiple, addressing ACEs, addressing trauma, those kinds of things. So that's what I'd say.
Leanna?
Yeah, I would completely agree with that, Christine. I think the more we can build risk and protective factors and provide children and even parents with the tools to, you know, be resilient and cope, and what are the tools to kind of help them live the best life that they can live, it's kind of getting at the root cause of what's going on versus, you know, the aftermath of what happened. So trying to get as upstream as we can, but then providing as many tools and resources and skills for people to be the best they can. So.
Yeah, I think our focus on SEL is because of that blanket effect and really trying to find a way that all schools will be able to access it. I mean, that's part of the key is no matter how good your program is, if it isn't accessible, then it won't work. The other piece of that is, as much as, you know, SEL will have a significant impact on individual students and on those school cultures, without those secondary and tertiary supports, you know, those families are struggling, which means that it's putting more impact and stress on kids. And so prevention really needs to be that wraparound support. We need to have primary, secondary, and tertiary. And understanding. And I'm constantly working on building that understanding so that it really does become as important as teaching kids to read, is that getting them these services and supports.
Yeah, these next two questions are yours, and let me put it in the context that I'm well aware that Commissioner Macon made it a strong commitment to try to get this curriculum to every school on a no-cost basis, and that has been done. But this question, the question stated, how has the COVID pandemic affected the Department of Education's ability to implement these ideas and goals?
I mean, I think one of the benefits is that we did a lot of pre-planning on making this available as a platform base. And that has really led to us to be able to not only have it easily accessible for teachers and educating staff, that it's right there, that it's something that they can assign to kids in remote and hybrid situations. But really our shift into that synchronous and asynchronous training world, that we're providing tens of thousands of contact hours to support staff, and that staff are used to that now. And so, you know, I'm still getting, you know, 150, you know, members every week joining for trauma-informed practices and school-based mental health support. And so, you know, as much as I'd love to be running huge workshops like I was before, we're still going to be running workshops. We're going to be taking advantage of this virtual space. And instead of people having to travel from Aroostook to, you know, south, or for us going north, it really allows us to have a much wider reach. And the asynchronous, like micro-credentialing is something that will really, really be helpful and allow us then to go in and work with schools individually and fine tune things rather than focusing on some of these larger trainings all the time.
The next one, I know you can answer quickly. Can non-educators use the SEL for Me program to support schools? The questioner is with a nonprofit organization that has federal drug-free community funding.
Yeah, so we really wanted to keep gatekeeping as low as possible. The commissioner wanted to make sure that this wasn't something that you know, we had to sort of dole out. We want community partners to be able to access this. And when you go into the login section, you can sort of pick whether you're a school, a community agency, whether you're in leadership, whether you're an educator. Parents can access this so that they can do home instruction. We've shared this with private schools, which is something that, you know, DOE and private schools usually don't have a lot of interaction, but we wanted to put this out there as broadly as possible and keep the barriers as low as possible. And we'll have ongoing trainings. That's really the key, is because the curriculum by itself without that support won't be as useful.
This is a tricky one. It's a tricky one for me to answer anyway. The questioner says, I'm not sure how many legislators are on the call, but what are the highest needs in the prevention area for legislation? Any of the three of you want, knowing that you're really not in a position, none of the four of us are, to speak for our offices and departments at this point. The budget hasn't been put together, just barely got the legislators sworn in, but do any of you want to address a particular need that you see without committing your commissioner or director to it?
Funding.
Funding. Yeah, I mean, the one thing we can safely say is that I think all of us, knowing that the pandemic has produced a structural deficit, we're trying to hang on to what we got. It's really difficult. And so far we've been somewhat successful at that, but all of these programs to direct at our children from the prenatal period right up to age 26, when our brains apparently are fully formed, need a lot of resources. I do want, there are a couple other questions. We're just about out of time, but let me deal with them. My friend Laura Morris reminds us that she's also involved with the Drug-Free Community Grant. And obviously there is a lot of overlap, and she's just reminding us that we ought to think of ways to make the state aware that in many districts that work is available. Or I can tell you that, I mean, it's my highest priority. I'm not a prevention specialist, but to get all the good work that's going on and get the interests aligned so everybody's moving in the same direction. That is, in fact, why the governor created this position. And so I'm with you there. Our friend Liz Blackwell Moore is going to get the last question. And Liz, thanks for joining us this morning. I'm wondering, Liz says, I'm wondering if there have been conversations about expanding prevention funding and focus to include improving the community conditions in which people live, like housing, stability, living wages, behavioral health access, et cetera. To which I'd add, you know, it really takes us right into the social determinants of health. And any of the three of you want to make a comment on that? Hearing none, I think, Liz, it's fair to say that, of course, there are conversations all the time about trying to do more in the prevention area. You're addressing almost a global issue. I mean, we know it's just like the people in recovery. We know that people aren't going to do well in recovery if they don't have a roof over their head. We know that children aren't going to do well if they're living in an automobile with their mom. And so we know that people have to have a living wage, and access to health care and mental health care and substance use disorder treatment. So yes, there have been conversations. We are talking about it all the time. And with that, I want to again thank the panelists, and please thank your office directors and commissioners as well. I think Commissioner Macon, Commissioner Lambrew, Dr. Shah, and Dr. Landry all are so supportive of our work and your work. And I know you appreciate it as much as I do. Again, I want to thank AdCare. They've been a great partner in putting together our seminars. I want to thank Roland Robinson, our opioid response project manager, who puts these together with my assistance. And I hope we'll see you all on January 8th, and have a wonderful holiday. There may be snow over the weekend, so stay safe. You're not supposed to be traveling anyway, but stay safe and have a happy New Year.
Thank you. Bye.